PHAEYDE Clinic. How can I help you?
Hello, I will be getting a hair transplantation in a few days and I have a question, that is, do I have to cut my hair at home today?
You do not have to cut your hair at home. Come with the hair length you wish to wear in the future. If your hairstyle is 15 centimeters or longer and you do not want to go from having long hair to having short from one day to the next, then maybe you could have your hair cut shorter, to about 2 centimeters. That way the change will not be so radical for you or the people in your environment.
Thank you, see you tomorrow.
See you tomorrow, goodbye.
Doctor, I'm a little scared about having my head shaved bald before the implantation procedure. Is it necessary to cut all my hair off?
At our clinic, we do not need to cut your hair all off. However, in the area we are working with, it is generally required. If someone wants to implant among long hair, it always depends on the amount. Because we cannot implant 2,000 grafts between long hair, it would take too long, as implanting among long hair is always more time consuming. It is important that we clear up what long hair means, 10 centimeters or longer. If your hair is shorter than this, unfortunately, we are going to have to cut it before the transplantation to be able to work with it.
How short does my hair have to be cut to be able to carry out the procedure?
We must always cut the donor area short. This is the back and sides of the head between the ears. It extends about 6 centimeters at the ears and 8 to 12 centimeters at the back of the head. It is about 30 centimeters wide, which means, depending on the patient's head, we have 180 to 220 square centimeters of donor area to work with. We will generally cut hair to 1 to 2 millimeters in the donor area because the very thin needles our doctors work with cannot be used with anything longer. Of course, it is not always necessary to cut the whole donor area completely short. The area to be cut depends on the number of grafts we need.
Do you have to cut the hair in the target area as well?
In cases when it's very necessary not to, for example women and patients with 10 centimeters hair, or longer, we may not have to cut the target area short, if we are only transplanting a small amount because we can implant up to 600/100 grafts among long hair. However, if the amount of hair to be implanted is any more or the patient's hair is shorter than 10 centimeters, then we must cut the target area short as well. If a man requests the implantation of the area above the forehead, then we do not need to cut their hair short everywhere. But the rule that if your hair is shorter than 10 centimeters then it must be cut still applies here. And the overlapping areas have to be cut short too. But for the parts of the scalp that are neither donor nor target areas, we can leave the hair as is. This is usually going to be the upper part of the top of the head. If you don't have any more questions and you're ready for the procedure, then please come with me and we can begin. If you would like to see similar content, subscribe. We hope to see you soon at PHAEYDE Hair Transplantation Clinic.